So I think we'll go ahead and get started. Thank you everybody for joining us this evening. My name is Julia Holbrook and I'm the Executive Director of Karuna Precision Wellness Center. This is our third webinar that we've offered this year with more to come. Tonight we are joined by our own founder, Dr. Jamie Renbarger, who founded Karuna Precision Wellness Center to address the gap in integrative care and provide survivorship plans tailored to the individual. And we offer therapies such as nutrition, exercise, mental health counseling, acupuncture, massage, and neurocognitive therapy for what is commonly referred to as chemobrain. And just a quick plug, we have rescheduled. Tonight was originally going to be Dr. Anthony Magliocco, and he had to change due to a scheduling conflict. So he is rescheduled for June 14th. And that, again, that's Dr. Anthony Magliocco of Protean Biodiagnostics. And he'll be doing at the same time at 7 p.m. Eastern, advances on precision medicine, updates on precision medicine advances for patients living with breast cancer. And then we'll be on a short hiatus for the summer months, coming back in September, on September 22nd for a third annual Cancer Wellness Symposium. We have a great lineup of speakers right now to speak on integrative oncology. Dr. Wayne Jonas, Dr. Jonathan Stiegel, and Dr. William Lee, who will be presenting on Eat to Beat Cancer. So with that, I'd like to introduce our founder, Dr. Jamie Renbarger, and she's going to tell us how to prevent, or steps we can take to reduce our chances of getting cancer in the first place or mitigating a recurrence.
Yeah. All right. So thanks everybody for joining tonight. I'm still not sure what I think about presenting virtually as I stand here in front of my computer by myself. But hey, my goal is for this to be as interactive as possible. My background is in pediatric oncology and in cancer wellness and survivorship. And if there's one thing that I've learned over the course of my career and my life, especially now as a parent of two teenagers, it's that I don't have all the answers by far. And in fact, no one does. And so this interaction, this talk tonight, is really meant to remind you of some things, hopefully give you some new information, and to talk about steps that you can take in your lifestyle to really try to mitigate your risk for developing cancer. None of these things prevents cancer in and of itself, but certainly there's steps that you can take to decrease the risk that you have as an individual. So with that, I am going to share some slides. I made some slides as backdrop and really to hopefully, I sometimes think, being able to see a figure helps us to really conceptualize some of these concepts that may be new. So with that, all right, we will go into our presentation mode. So why are we here? What's the point of this? The reality is that despite numerous advances in cancer treatment and doing a better and better job of curing an increasing number of cancers, the incidence of cancer is on the rise and continues to go up. As of 2014 in the United States, the incidence of newly diagnosed cancer was about 1.6 million cases, and it's estimated that within the next 10 years or so, we'll surpass 2.4 million cases. And there are a variety of reasons for this, and we're going to touch on again some of the things that you can do. So as a foundation, I think it's important to understand what is cancer. And what are the key steps or key ways that cancer often develops in a very simplified format. And then a top 10 list that we've pulled together that includes some things that you'll definitely expect would be on the list, and maybe a couple of newer concepts. And then we'll review and talk about sort of what's the take home from all of this. Please feel free to ask questions at any time. I'm guessing there's a way you can raise your hand, although I'm less familiar with WebEx than I am with Zoom. So, but feel free to interrupt, and we'll try to save some time for questions at the end. So what is cancer? And so here again, very simple cartoon of a normal cell undergoing some genetic changes or mutations that result in development of a single abnormal cell that begins to grow out of control, creating this mass or population of malignant cancer cells. There are benign tumors as well as malignant tumors. We're focusing specifically on malignant tumors, which differ from benign tumors in some important ways. But again, suffice to say, genetic changes result in the development of cancer. I think what's also important, I'm going to let a doggy in the room here. I think what's also important to know is that our bodies are really set up to help in protecting us from a whole variety of abnormal cells, right? From infectious agents to these abnormal cancer cells that in fact our bodies are producing all the time, right? We're developing new mutations all the time from exposure to things like the sun. And in fact, our bodies have built-in mechanisms to repair damage to the DNA, so to repair those mutations. And then when a cell sneaks through that could go on to develop cancer, our bodies are also set up to identify those cells and attack them as foreign or as abnormal cells. And so that's what you see here on the top, this cell suicide or apoptosis. So resulting from cell damage that doesn't get repaired. And so again, our body can repair that damage or can take care of those bad cells. There are a variety of reasons why that doesn't happen sometimes. And that's one of the things that we're going to talk about, right? So mutations happen all the time. And so there are a variety of ways to protect yourself or that your body has in place to protect yourself from cancer. Again, lifestyle approaches or other things that you can do to try to prevent damage to DNA. Your body then, once that does happen, again, can repair DNA and is constantly on the lookout and surveilling and clearing those abnormal cells before cancer develops. In the interest of time, we're not actually going to get into to the types of cells that are necessarily involved, but suffice to say, it's a complicated system that works really well a lot of the time. And so what does damage DNA? And in fact, this is what we're going to talk about tonight. What are the things that either cause DNA damage or that disrupt the body's process for taking care of abnormal cells, either by killing them or by fixing them? So we're going to jump right in. And I'm going to, you'll see, get into some of these topics more than others, just based on both my level of interest or sort of the societal culture, our culture's level of interest at this point in time, and how much people have already had things sort of beat into their brains. The number one thing and the biggest impact that anyone can have in decreasing their cancer risk is to avoid exposure to tobacco and to smoke generated by tobacco as well as tobacco products itself. And so that includes not only chewing tobacco, but also smoking any sort of tobacco and exposure to secondhand smoke. So how does smoking cause cancer? You know, the reality is that cigarette smoke and tobacco itself involve a whole bunch of toxic chemicals that can enter our lungs and actually reach a myriad of organ systems in our body. And so smoking is not only increases one's risk for lung cancer and oral cancers, but for a variety of other types of cancer as well. And it does that by damaging DNA, including, and this says parts that protect against cancer, but that is the DNA repair pathways, and causes chronic inflammation. And so we'll talk more about chronic inflammation as we go through, as we go over the next hour. So again, causing DNA damage and making it harder to repair that DNA damage. And over time, the accumulation of more and more DNA mutations can lead to cancer. And again, a whole variety of cancers. Again, as I mentioned, avoiding tobacco is the single biggest, best thing that one can do to decrease their risk for cancer. And again, tobacco is associated with a whole variety of types of cancer, including certainly most commonly lung, but also a variety of GI tract cancers starting from the mouth and going all the way down, as well as other major organ systems and leukemias. So big deal. From there, another big source of DNA damage is exposure to ionizing radiation. And I'll note with tobacco, I didn't delve into how to avoid or ways to stop smoking. But certainly, if anyone's interested in information about smoking cessation programs, we can definitely provide that information for you. So next, ionizing radiation is another significant source of DNA damage. UV exposure and exposure to other sources of ionizing radiation, as you can see in this cartoon with sunlight. It is specific types of ultraviolet light that cause DNA damage, and by and large, that DNA damage, the repair of that DNA damage is what prevents cancer related to sun exposure, but it's really, really challenging to avoid it completely. And in fact, there are some beneficial effects of exposure to the sun, including as a source of vitamin D. But in addition to the sun, things that you might not think of as frequently or as easily include things like CT scans as a source of radiation. CT scans, other types of radiographic examinations, right, like X-rays, also cause exposure or give exposure to radiation, but the radiation posed by CT scans is significantly greater enough that it's worth mentioning, particularly for individuals who it's particularly harmful or potentially harmful for people who need to have recurring CT scans for any reason related to chronic illness or otherwise. Nuclear plant workers or workers who in the course of their jobs are exposed to radiation are also at increased risk. There's some natural background radiation, and then finally specific types of nuclear medicine scans. And I think, an important thing to note is that a single scan or even a series of scans or other exposures over the course of one's life don't equal cancer, but being mindful of and understanding how some of these exposures can actually be cumulative over time is important to be aware of. So skin protection, I don't want to belabor this, as I think a lot of people, it's in the general public that the use of sunscreen or some kind of sun protection, including specific clothing, covering your entire body, wearing hats, are topics that are frequently talked about. But I think it is important to really understand the impact of these measures in decreasing risk for things like melanoma, which is a very high risk and aggressive cancer in many cases. So, and I'm not going to get into the details of that anymore. I'm happy to answer questions about that later, and to provide these slides for anyone who would like more information. Number 8, alcohol. Limiting alcohol intake is a key recommendation. There are clear data associating alcohol intake with the development or increased risk of development of a variety of cancers. How does this happen? Well, alcohol not only damages cells, damages DNA, but can also increase the effect of things like DNA damage from tobacco, and is also known to increase the risk have a significant increase in risk for developing breast cancer, as well as GI cancers, where there is actual direct exposure of those organ systems to alcohol. And that is really the result of alcohol being metabolized into a whole series of toxic compounds, again, that our entire body is really exposed to. And so can you manage that risk? The recommendation as of 2007 was that if consumed, one should limit alcohol intake to 2 drinks a day for men and 1 drink a day for women. That's been updated more recently to be more conservative in saying, for prevention, it's really best to avoid alcohol intake, but certainly to minimize alcohol intake as much as possible. I think it's important, and I've gotten questions before about whether the type of alcohol consumed alters risk. At this point, there are no data that I'm aware of that show an increased risk, say with higher proof alcohols or other things like that. But there's ongoing research evaluating that more fully. I think another important thing to be aware of is, in fact, that alcoholic drinks that are mixed with or made with sugary mixes increase risk for obesity, which further increases risk for cancer, and is one of the other things that we're going to talk about here in just a little bit. So alcohol for a whole variety of reasons. And with that, after mentioning those sugary mixes, number 7 is to avoid obesity if at all possible, and specifically excess body fat. And so what does it mean to be obese? Having a body mass index of above 24.9 is what is typically considered being overweight, and then above 30 is considered or is defined as obesity. And for the vast majority of people, that actually means or is associated with excess body fat, but not for everyone. And so that's why it's important to be aware that someone like a big bodybuilder and a really massive bodybuilder would have to be, can actually have a high BMI, but not have excess body fat. And there isn't enough research to really understand risk in that population. However, the risk seems to be associated with increased body fat. So why is that? What exactly is going on? Well, it comes down to the fact that fat and fat cells not only produce a variety of hormones and growth factors that can lead to proliferation or growth, but they also can result in chronic inflammation and altered sensitivity to insulin, so an increase in blood sugar over time, all of which can impact immune function and cause chronic inflammation, which not only can increase one's risk for developing cancer, but for a whole variety of other chronic illnesses. So this is not, again, similar to tobacco or alcohol. These risk factors aren't rocket science, and they're not specific to cancer, although that's our focus for tonight. So to dive into that in a little more detail, fat cells increase estrogen production, as well as cytokines, which are chemicals that are really important in our body and our inflammatory pathways, but do promote inflammation. And in this case, that chronic inflammation may impair immune function, which again is important for identifying those bad cells and repairing DNA damage and killing cells that get through that pathway. As I mentioned, increase in body fat can trigger resistance to insulin, which can actually progress to type 2 diabetes or metabolic syndrome. And it's become clear that high levels of insulin and insulin-like growth factor can in fact promote the development and growth of cancers or progression of cancers. So, and the types of cancers that obese individuals are at increased risk for is significant. Everything from central nervous system cancers to breast cancer, GI organ cancers, as well as endometrial cancer, and in fact, multiple myeloma kind of blood cancer. So, so again, a whole myriad of cancers. And the take-home message, really, the CDC estimates that overweight and obesity is now associated with over 40% of cancers in the United States. And the goal is to maintain a healthy weight without being underweight, and to actually maintain a healthy weight and avoiding big fluctuations in weight throughout adulthood. And for anyone who's interested, I think both in terms of cancer prevention as well as prevention of cancer recurrence, I think our goal with Karuna is to really provide services that help individuals in addressing these things, and in being as healthy as possible and optimizing health and wellness to prevent cancer, but also to prevent recurrence. So happy to talk more about that piece at any point. And finally, food. So eating a healthy diet. And you know, I think there's been more and more research over the last decades, in particular, on food and specific kinds of food. We're going to talk at a pretty high level, not so much in the weeds. But again, I'm happy to answer any questions or to delve into more detail, or to listen to your all's experiences with food or some of these topics. So food as medicine. We know, you know, with research done in evaluating the impact of diet on our bodies and a whole variety of our body systems, there have been some really, I think, helpful and fascinating findings. And first and foremost, that eating a healthy diet, among other things, can improve immune function, and which can help in preventing cancer. This cartoon, while it may look like a simple cartoon, the illustration of the healthy fed mouse having, which you can see on the clipboard here, is an increase in NK cell or natural killer cell function and numbers, is is known to be important in not only treating cancers, but also in preventing cancers. So what does that mean? Let's see here. Here we go. Okay. So what does that translate to? Probably a lot of this is stuff that you all know or have heard something about. But there are some key components of dietary risk. And so diets that are low in the orange things here, fruits, vegetables, whole grains, nuts and seeds. Milk, I would say milk is becoming a little more controversial. But suffice to say, certainly there are some protective effects of milk as well as some risk factors associated with milk and the inflammation, gut inflammation associated with that. Fiber, calcium, seafood-based omega-3 fatty acids, as well as polyunsaturated fatty acids. So these are all things that we want to enrich in our diet. And then minimizing things like red meat as well as processed meats and sugar sweetened beverages, and things that have white sugar in them, I think are definitely associated with an increase in risk of developing cancer. Diets that are high in trans fatty acids, as well as high in sodium, and especially salt cured and pickled foods. So all important things to keep in mind, and we're going to talk about why that is and in a little more detail. So I think that this is interesting, just in terms of understanding where some of these items fall and how important it is to try to minimize intake of certain kinds of meats, is probably helpful. And that is that processed meats. So first of all, what we see here is things like the processed meats, and then pork, beef, and lamb. And what these categories represent here are how likely something is to cause cancer in humans, but it doesn't quantify how many cancers it causes. So I'm going to so the highest risk meat products include things that are processed and cured. So salami, other processed lunch meats, bacon, and as well as sausage and hot dogs and things like that are the highest risk group of meats. And red meats, in terms of their risk, again, beef, pork, and lamb, if you consider all of those red meats, have a group 2A classification, which means that they are probably associated with cancer. And there are other classifications for other types of meats, but those are the most important groups to pay attention to. And what about sugar? Well, high sugar intake is associated with an increase in weight and obesity, which in fact are associated with an increased risk of numerous cancers. I put this figure in. I don't think we'll get into, I don't want to get into detail of it, the details of it. However, what's important is not necessarily all the stuff in the middle, but the take home, and that is that in particular with high blood sugar and chronically high blood sugar, the different signaling pathways move toward an increase in DNA mutation, an increase in cell survival and proliferation, as well as invasion and migration, which all go along with proliferation of cancer. So minimizing sugar intake certainly, again, has a variety of health benefits, as well as in avoiding cancer. And I don't want to belabor this, but I found this figure really to be a great summary. It's talking about a variety of different factors, but in terms of the American Institute for Cancer Research and their 10 cancer prevention recommendations, I think it's interesting that there's one, eating a diet rich in whole grains, vegetables, and beans, limiting consumption of fast foods, limiting consumption of red and processed meats, sugar sweetened drinks, and alcohol. And then not using supplements, which is something that we'll touch on here a little bit. But over half of their recommendations have to do with dietary recommendations. So what can you do? We talked a bit about, or kind of flew through the list of foods that it's important to try to enrich in your diet. And many of those are foods that fight inflammation, chronic inflammation, and the impact of chronic inflammation on immune function is increasingly recognized as an important factor in terms of the development of cancer. And so what are some of the best anti-inflammatory foods? Things like tomatoes, fruits, and specifically berries, strawberries and blueberries, oranges and cherries are some of the best. Nuts, and specifically almonds and walnuts, as well as other nuts, leafy greens, olive oil, and fatty fishes, fatty types of fish, including salmon and tuna. And they include here specific foods which we've touched on, and I think most of us know, or all of us know, are not part of a healthy diet, but foods that are associated with an increase in inflammation. So an anti-inflammatory diet can be a really important part of something that you can proactively do to help in protecting yourself and to optimizing your immune function. We do, for anyone who's interested, our clinical nutrition specialist is a wealth of knowledge, or really has a wealth of knowledge about diets that anti-inflammatory diets, and in fact has given a webinar, one of these webinars, on anti-inflammatory cooking, she's amazing. She's a great speaker, and would be something to consider next time that rolls around. In terms of supplements are not known to decrease one's risk for developing cancer. So that is, we can't get all those nutrients through a whole bunch of capsules and know that they're going to be as effective in decreasing your risk for cancer. Having said that, there are a variety of, or a number of supplements that I take, and that sometimes it's a little difficult to get enough of them in the course of my daily diet. The one that I would just touch on it's very well established is vitamin D, and in fact D3K2. Living in the Midwest, no one has adequate exposure to the sun. So nearly everyone who isn't taking significant doses of vitamin D supplements has low vitamin D levels. And so always, again, something that I would recommend if anybody wants to talk more about it, we're happy to at Karuna, or to talk with your physician about the possibility of supplementation, although I'm guessing that some of you are already taking some of these supplements. All right, so moving on, number 5, be physically active. So how does that work? Being physically active is actually one of the key things that one can do to decrease risk for cancer. In fact, the lack of regular exercise is associated with an increased risk of developing everything from breast and endometrial cancers to colon and other GI system cancers, bladder cancer, and kidney cancer. And for those of you that have never been on this website, the American College of Sports Medicine has a subgroup focused on exercise as medicine. And they have, I think, some great resources around using exercise as medicine. So obviously multiple beneficial effects, and those are some of the most important cancers that you can decrease your risk for. And so how does this work? We're just going to dive briefly into some of the results of exercise. So exercise increases insulin sensitivity. So it makes your cells more sensitive to insulin in your circulation, and it lowers blood glucose levels or maintains a more stable glucose concentration in the blood. Exercise also decreases blood lipid levels and increases mitochondrial function. So mitochondria are a sub part of the cells that are important in this whole immune response process. Exercise can decrease chronic inflammation and can increase muscle mass and strength. And so again, increasing relative muscle mass and decreasing relative body fat, which we talked a bit about earlier in the talk. So I think it's important to note that these really all link back to not only overall health and wellness, but in terms of cancer risk, really go back to decreasing inflammation and improving immune function and surveilling for cancer. So what's the take-home message in this? The take-home message is to be physically active as part of your everyday life at a minimum. Walk more, sit less. And the recommendations from the American College of Sports Medicine and the Centers for Disease Control include getting 150 minutes of moderate intensity aerobic activity every week. Right, so this is 30 minutes, 5 days a week of moderate intensity exercise, as well as strength training, muscle strengthening activities on 2 or more days a week. That really are whole body workouts. And again, Brooklyn is on this webinar tonight. Brooklyn does a lot of the one-on-one training, as well as teaching our bi-monthly HIIT classes at the Healthplex. So for anyone who's interested, I think sometimes one of the biggest challenges for people who don't exercise on a regular basis is just getting going, is really developing that habit. Brooklyn, I think everyone who has walked through Karuna's doors and worked through Brooklyn has had a great experience with her. So feel free to reach out to us about that. So number 4, minimizing stress and anxiety and getting an adequate amount of quality sleep. This is probably the most controversial topic that's on our list. And I definitely the data to support minimizing stress and anxiety and sleep in terms of a direct relationship to cancer is not as strong as any of the other things that we're going to talk about. And I think that there's such a clear association between stress, anxiety, and having an adequate amount of quality sleep with not only immune function, but also chronic inflammation and obesity and a whole variety of alcohol use and a whole variety of other things that are on our list. And so I think I really consider it a double whammy, if you will. And so we'll talk just a little bit about what's known about stress, anxiety, and sleep. There are a variety of processes. While the clear association between someone having chronic stress and developing cancer is not as strong as with some of our other things, There are a whole variety of cancer promoting processes that are increased or caused by chronic stress, including activation of inflammation, inhibition of immune function, inhibition of programmed cell death, right? That's taking care of those cells that slip through and are so damaged that we can't fix them. So key, obviously, in identifying those abnormal cells and taking care of them. Decreasing function of the natural killer cells. I mentioned NK cells earlier in this talk. And again, we need those guys on our side. Inhibition of DNA repair, which again, mutations happen. They happen all the time. And our body does a great job of fixing them. But this stress is definitely something that can impact DNA repair. And then stimulation of blood vessel growth and activation of one of the pathways for development of cancer stem cells are on the growth side, and that are really important for growth and development and propagation of cancer. So pretty compelling and supportive evidence of the role of chronic stress. I think where it gets challenging and confounded is, again, the overlap with a variety of other things on our list. So I've found this particularly interesting, and just wanted to highlight here 9 factors that affect our immune health, including lack of sleep and chronic stress at the top, but also including a number of other things that we've talked about already and some things we have yet to talk about. And what I didn't mention with exercise is, and something I want to touch on right now, this just reminded me, is that with physical activity and exercise, moderation is the key. Physical inactivity is bad, but excessive exercise can also cause suppression of immune function as well. And so doing things in moderation when it comes to physical activity, as well as with dietary interventions, I think are really is really the best approach. And then the panel on the right touches a bit on specifically on sleep loss. And what we're referring to here is getting not enough quality sleep. So it's important to note not only quantity, but also quality, and how that can impact the immune system. And down in the lower left, the NK cell function, so sleep loss is clearly associated with NK cell function. Most of these studies have been done in people experiencing sleep deprivation, and so again, less in people who have, chronically poor sleep quality, but what's known as the NK cell function is impaired, is decreased, which can not only increase one's risk for cancer, but also for development and progression of viral infection. So again, I think the question is, what can you do? What can you do about sleep and chronic stress or anxiety? I think first and foremost, being aware and addressing stress and fatigue are key. I think in our society today, we definitely, we live in a fast-paced world with a lot of social connections and technological things at our fingertips, with a cultural expectation for rapid responses and sort of being on a lot. And so being aware that if you're feeling stress and fatigue, it's not necessarily, I think I have found myself definitely stepping into the place of saying, oh, you know what, this is life, right? This is what I need to do. I just need to keep up. I need to, And in fact, that can definitely catch up with you. So, so I think being mindful of that. There are a variety of things that, you know, certainly interventions for mental health challenges in general, and specifically anxiety and stress. I've listed just a few of them here. When it comes to sleep, certainly there are a variety of approaches one can take, but sometimes understanding the quality of sleep that you're getting can be a little more challenging, and is something that that I'm happy to, you know, have a session and talk with anyone about in more detail at any time, or that we can potentially talk a bit more about at the end. And back on the kind of beaten path again, number 3, it's important to minimize our exposure to environmental toxins. What in the heck are important environmental toxins? So the most important contributors to cancer in our environment, the most important one is solar UV radiation. However, there are a variety, and I apologize, these cases, case numbers are for Canada and not something that I think that, you know, I didn't put this up here for the numbers, but more for the relative sizes of the circles, as well as the variety, including things we've all heard about like asbestos and secondhand smoke, as well as air pollution and a variety of other chemicals that we can be exposed to in our environment. I think what my guidance is on this, and this is something that's important, I think, to understand based on not only your home environment, but also your work environment. And that is, what are the key exposures that you as an individual have, and what you can do to mitigate that, your exposure to those things. And again, I'm happy to talk in more detail about this with anyone one-on-one, or we can chat more about it near the end. So, and that was my only point. Awareness and remediation are key. Finally, number 2 is to avoid cancer-causing pathogens and vaccinate against them. This is a really important one, and I think will go on to be, sorry, can't forward my slide, there we go, will go on to become even more important, more and more impactful as the HPV vaccine, which was recently, you know, has recently come into mainstream primary care, as more individuals actually receive that vaccination. So there are 4 key cancer-causing pathogens, including Helicobacter pylori, we'll talk about more in a minute, hepatitis B, hepatitis C, and human papillomavirus. H. pylori is a bacteria, and H. pylori infection is sometimes associated with an increase in gastroesophageal reflux, and can be eliminated with not only suppressing stomach acid, but also antibiotics. And so I think it's the recommendation here that I think for everyone to be aware of is for individuals with chronic reflux, who are self-medicating with stomach acid suppressants, having that chronic reflux evaluated is really important, because in fact, if H. pylori is involved, then being adequately treated to clear it can be incredibly beneficial. Hepatitis B and hepatitis C viruses are also associated with a variety of kinds of cancer. I think the key here in terms of prevention of hepatitis B is vaccination, and now that is incorporated into the childhood vaccination schedule. And then in terms of hepatitis C, There are a variety of new and FDA-approved antiviral drugs that can be used to mitigate infection with hepatitis C. HPV is probably the newest kid on the block definitely the newest kid on the block in terms of cancer preventing vaccinations, and has been a major breakthrough. There currently are FDA-approved vaccinations to protect against specific strains of HPV that are strongly associated with the development of cancer. And I think it's important to know that we're not only talking about genitourinary system cancers, right? So things like the Pap smear for detection of cervical cancer and cervical atypia, but human papillomavirus is also associated with a large number of head and neck cancers. And so all that to say, HPV vaccination is not only safe, but also effective, and will ultimately be important in preventing a large number of cancers, not only in females, but also in males. And finally, I think I'm running low on time here. So finally, number one is to be aware of your family cancer history and get screening tests done and done on time. Cancer screening, as somebody who, drags my feet at times as well, cancer screening can be sort of a pain in the butt to just do. But it is clearly associated with not only a decrease in cancer incidence by detection of precancerous lesions, but also with a reduced incidence of advanced disease. So catching cancers early when they're potentially in their most treatable state, and as a result with reduced mortality, cancer-associated mortality. Certainly, adverse events can happen with everything from a colonoscopy to a Pap smear to a mammogram, but they're rare, and really, in terms of a risk-benefit comparison, the benefits far outweigh the risks. False positive and false negative tests do happen, and on a population basis, these are still key things not to ignore. So what are the screening recommendations? I'm not going to belabor this, but screening for breast cancer, cervical cancer, colorectal cancer, and lung cancer, depending on your exposure history, are all important. There are specific recommendations based on family history and other cancer predisposition genes that may increase one's risk for developing certain types of cancer. But I'm happy to talk more on a one-on-one basis with anybody about their specific risk. And so to that end, how do you know if you're at increased risk for an inherited cancer? And the bottom line is family history, right? Family history of lots of cancers, sometimes of specific types of cancers, or cancers within certain organ systems, childhood cancer, and especially more than one childhood cancer within a family, and at times development of a really rare type of cancer can be associated with a cancer risk gene. So what is a cancer risk gene? Well, what do I have here? We'll wait on that for a second. A cancer risk gene means, when a cancer develops, and we talked about mutations in cells that go on to become cancer. In fact, people who have a genetic cancer predisposition gene have a risk mutation, so have a genetic change that is it's present in all the cells of their body. And so that's an initial hit or an initial mutation to those cells that can go on to set them up for an increased risk of more rapid development of cancer with additional mutations. So again, having a specific risk gene doesn't equal cancer in most cases, but certainly can increase risk from a little to a lot, depending on what the gene is. So if anyone has questions about their genetic risk or whether they may have an inherited cancer gene, we're happy to talk more about that. What I would recommend is probably follow up with a genetic counselor or with a cancer predisposition clinic. So the another key thing is that beyond inherited cancers, certain medical conditions can also increase cancer risk. So ulcerative colitis and Crohn's disease, both inflammatory bowel diseases, can increase risk for developing colorectal cancer and other kinds of GI cancers. But in fact, the increased risk with those pales in comparison to the increased risk for cancer in individuals with type 2 diabetes, and specifically liver, pancreatic, and endometrial cancers are clearly individuals that with type 2 diabetes are at increased risk for those types of cancers. And again, happy to talk more about that. But so what does all this mean? Well, in fact, what this boils down to is that nearly 50% of the most common cancers can be prevented, or certainly we can dramatically decrease our risk for developing them through lifestyle interventions and understanding our risks. And what that translates to is really awareness of and addressing many of the things that we talked about tonight. What the bar graph on the right shows is the relative contribution to cancer incidence. So all of these together would add up to 100%. And so what this is telling us is that tobacco use represents over 30% of that increased risk. But including things like obesity and overweightness, pathogens, that's the viruses like hepatitis and human papillomavirus. There are some unknown factors: physical inactivity, diet, exposures, alcohol, and the list goes on and on. But I think as a take home, just to give you an understanding of how much relative risk or relative contribution each of those factors plays in this discussion, I think that's a great visual. So with that, I just want to say thanks so much. Hopefully this has been interesting and engaging. Happy to answer any questions and would love any feedback anyone has. This is our first time with this presentation tonight, presenting on this topic, and it's something that's near and dear to my heart. So I would love to make it more refined and better. And so welcome any feedback. So thanks.
So if anybody has any questions, there should be a Q&A box down in the bottom right-hand corner of your screen, or maybe in the middle of your screen. Does
Questions
anybody
or
have any
comments?
questions? Yeah. I'm not seeing any coming in.
Okay. Well, hopefully everyone knows, how to reach us at Karuna, how to get in touch with Julia, Brooklyn. And again, I am happy to talk with anyone more one-on-one at any time. Our goal is, again, with Karuna, to provide services that individuals need and want to live healthy, happy, productive lives, and optimizing health and wellness after cancer, but also preventing cancer and preventing cancer recurrence. And so we're happy to hear from anyone.
Okay, so we hope to see you guys again on June 14th for our next webinar. Please reach out to us if you have any questions. We had a slide up at the beginning of the webinar, but you should, through the email registration, also be able to get a hold of me if you have any questions. So thanks again for attending, and we hope to see you again soon.